round oval. Next, the surface of this element is mirror-like. Sometimes the inner structure may be hemorrhagic because after the penetration of erythrocytes, possible formation of the micro wound-like element. But it's very important because the first may be misdiagnosed, such as mechanical trauma. No, this isn't mechanical trauma, but this erosion or ulcer, such as clinical signs of the onset of this disease. Next, it's very important, this information in gynecology. You can find this element on the labium, and don't forget that erosion or ulcer may be single or multiple, and may be the clinical presentation of syphilis, because you know that formation of ulcer or erosion will vary in the duration of, you know the diseases, herpes progenitalis, in the duration of candidiasis, in the duration of inflammatory diseases of genital sphere, and don't forget that one of the reason of the formation of this element may be syphilis, and you must remember about this possibility, or one or multiple or single or multiple elements may be as a clinical signs of this disease. Next, the size may be different, may be small size, normal size, and giant form of this syphilis, of this element, and don't forget about the variation in size of this element, because sometimes, very often, they misdiagnose according to the size of this element. Multiple elements. You can see this situation of multiple elements, multiple erosions, or multiple ulcers, such as clinical signs of this disease. Unusual localization. Genital area, anus. In the anal region, possible formation of ulcer durum, because the basis is very strong, and that's why the name the ulcus durum. The formation of this element in the membranous of the rectum. You understand, you are the children, that this is a result of the sexual intercourse per annum, and that's why possible formation as a result of the contact per annum and possible localization of the membranous of the anus. This localization is very difficult for the confirmation of diagnosis, because according of the ethical moment, your patient, as a rule, our patient does not indicate the area of possible localization of primary element. But if you find ulcer or erosion of the rectum, you must imagine that it may be as a clinical signs of the first period of syphilis. Don't forget about this possibility. Next possible localization is oral cavity. You can see the element on the oral cavity. You can see this element on the upper lip. You can see this element, erosion. And this element, very often, according to this element, we can register very often misdiagnosis of this disease, such as herpes, gingival stomatitis. You remember about that in duration of the herpes, you can find erosion, multiple. Then the other diagnosis, candidial, gingival stomatitis, and other diseases which are characterized by possible formation of multiple erosions. Pemphigus and other diseases, erythema multiforme and other diseases, and these diseases signs of the initial stage or onset of this disease. Next, you can see all the formation of ulcers, and this clinical case very interesting because you can see the process of edema of the lower lip, and the very important, the second clinical sign is enlargement of nearby lymph nodes. You can see enlargement of lymph nodes on the site of localization of this element. The similar enlargement of lymph nodes you can register in genital area. You can see this enlargement of inguinal lymph nodes on the site of the localization of ulcer. And this information is very important in gynecology because you can see the enlargement of lymph nodes, and you must imagine that the enlargement of lymph nodes may be as a clinical signs of the hernia inguinalis, maybe as a clinical signs of lymphogranulomatosis or disease of the blood, but maybe as a clinical signs of syphilis, initial stage of this disease. And don't forget about this possibility, predominantly in obstetrics and gynecology, because very often they misdiagnose of this disease. Next, it's possible localization of the tongue. It's very rare, but it's possible. You can see the ulcer of the tongue, syphilitic genesis. And don't forget about this possibility. Duration of this period, which is characterized by formation of the ulcus durum or the primary clinical signs of this disease and the enlargement of lymph nodes. Duration is nearly 4 or 8 weeks. And very important that we can divide this period into the 2 sub-periods. At the initial stage of this period, it cannot find any change in the blood. Without any change in the blood. And this is very important because your patient may have primary stage clinical signs such as ulcus durum, maybe enlargement of lymph nodes, but without change in the blood. And in this situation, what's the method of investigation you can use? You can take the material from the surface of this ulcer of erosion and then microscopic investigation. And the name of this investigation is investigation in dark field. I'm sure that you know this method of investigation because you have studied this method at the chair of microbiology. The method of dark field examination is very useful in this period. In the period when the blood is negative, and that's why the name is seronegative sub-period or negative result of the blood investigation. After this initial stage, the final stage. Final stage, you can find formation of scars and formation of the scars of previously affected ulceration of the skin or hyperpigmentation and scarring previously affected by the erosion. But maybe complications, predominantly in patients with coincidence of tuberculosis, such as HIV disease, such as oncological disease, you can find the complications of this initial stage of syphilis. And what complications? Possible formation of necrosis, possible formation of gangrena, possible formation of phagocytization or the amputation of the penis, and these are very severe complications of this disease. And don't forget about this possibility, because it's very severe complication of this initial stage of this disease. This period, the name of this period in our country is primary stage. In the other countries, the name is the early stage of syphilis. And the duration, you know, nearly is 4 or 8 weeks, and first half without change in the blood, and then with the change in the blood. About the other clinical cases, or which we can register later, we'll present you tomorrow. Today this information is necessary for you. Tomorrow you will come here